Welcome back. So today we'll be talking about an interesting case. It's pretty common to get tested on the USMLEs, so let's get right into it. And I'll be going through the differential diagnoses, the diagnosis and the treatment. So it's a 40-year-old man, right, that comes in um, to the clinic because of purple lesions in the lower extremity. The lesions are flat, progressively getting larger. They're progressively getting larger. All right, and they're not painful. He has a past medical history of multiple treatments of gonococcal urethritis. The patient has also been having diarrhea, nausea, vomiting, malaise, and cervical lymphadenopathy. All right, so anytime you have a question, right, first thing you want to do, first thing, I want everyone to have this, keep this as a habit. Always highlight the age, right, the gender, and why they're coming in. Coming in because of purple lesion in the lower extremity. Okay? And then I want you to think about things that can cause purple lesions in the lower extremities. I know they're really vast, but then let's continue on. Lesions are flat, progressively getting larger, blah blah blah, not painful. I mean, that could be helpful, but it's not that helpful. But this is helpful. He had multiple treatments of gonococcal urethritis. Okay, so he's a very sexually active male, and he's constantly getting STDs. Okay, this is constantly getting STDs. All right, and he also has things like diarrhea. This is also important. Okay, this is also important. So that's all you need, actually. That's all you really need to answer this question. Um, so basically here, I want you guys to really think about is HIV. All right, HIV/AIDS. So this is going to be a topic on AIDS. Anytime you see on a vignette multiple treatments of any STDs, okay, multiple treatments of any STDs, patient is from New Guinea, patient is sex trafficking, been getting anal pap smears in the anus, right? Has multiple sexual partners, does not use condoms consistently. Those are all keywords to tell you that patients at increased risk, these are risk factors for HIV and AIDS. Now, a person's getting purple lesions in the lower extremity. What is it? Kaposi sarcoma, right? Let's talk about differentials now. Think about Kaposi sarcoma. You're also thinking about like purple lesions in the lower extremity. You also want to think about something like Molluscum Contagiosum, Kaposi, right? Molluscum Contagiosum. All right, you also want to think about things like sporothrombosis, Schenke. You also want to think about like Cryptococcus. All right, these are just things you want to think about, but this is how HIV/AIDS presents. Why are they getting diarrhea, nausea, vomiting, malaise, cervical lymphadenopathy? Because it's like AIDS kind of causes like the HIV infection itself causes a systemic infection. All right, causes cervical lymphadenopathy, can affect the GI tract, and that's some of the things it can cause. So what do you do for someone like this? All right, so first things is you basically you want to consider all these things, and let's go through each one individually on the next slide. All right, let's go through each one individually. So we talked about Kaposi, right? You always want to differentiate Kaposi with something called bacillary angiomatosis, right? Angiomatosis. You always want to differentiate them. How do you do that? Well, Kaposi has multi-centric lesions. All right, so like lesions that are like kind of close to each other. If this is an area, they're kind of really close to each other like that. Multi-centric lesions. Versus this one, it actually has exophytic. exophytic pedunculated. All right, this exophytic pedunculated literally pops out like a pimple. Okay, it's like on a stalk. It's popping out on a pimple. Okay, um, this has multiple colors. This is more red, right? Bacillary angio involves the blood vessels. Mitosis, it's really red, beef like it's bright red, right? These lesions are purple and they evolve over time. So they can change colors. It can go purple, red, blue. So these change colors. Kaposi, and then bacillary angiomatosis also affects the internal organs, especially the liver, like or bone, right? It can affect the liver or bone. So you can have increased AST, and whatnot. Kaposi is mostly limited to the skin and the mucosa. You can even have Kaposi on the tongue and the oral cavity, but you want to think about the skin. Okay, so that's that. And how do you treat these? So Kaposi is treated. You give HART therapy, right? Highly active antiretroviral therapy versus bacillary angiomatosis. You give doxycycline. You give doxy. Okay, you give doxycycline because it's a bacteria. All right, so that's these two here. Now let's talk about Cryptococcus. That's pretty. Cryptococcus is pretty high yield too. It presents a lot on the exams. So for Cryptococcus, what you want to consider is actually you want to really consider things like so soil. Cryptococcus come from soil / the environment. Or you inhale it, goes to the lungs, right? The primary reservoir. This is high yield. Primary reservoir for Cryptococcus is the lungs. Then it goes systemically to the brain and whatnot and other places in the body. Remember, Cryptococcus neoformans causes meningitis-like presentation in HIV/AIDS. But why are we talking about it here when it has to do with skin lesions? Because Cryptococcus neoformans actually causes Molluscum Contagiosum like lesions on the skin. Okay, it's literally, so think about it like this. It's kind of, I guess, shortcut. So if you have a person with HIV or AIDS that has meningitis like picture, like headache, but Cryptococcus is special. You get headaches. So this is indolent. This is all really indolent, so subacute. Indolent headaches, subacute headaches, malaise, fatigue, fever, nuchal rigidity, Kernig-Brugensky sign if you want. But mostly like headaches, indolent headaches in HIV/AIDS patients or patients that are having multiple sexual partners. And then they also have skin lesions. They have lesions on the skin that are like kind of flesh colored. Think about Cryptococcus. That's like buzz for Cryptococcus. Okay, and then Cryptococcus is actually kind of unique because the regime for this is pretty unique. So you do something called induction, right? Consolidation, and then you do maintenance. Okay, so induction, give IV amphotericin B plus flucytosine. Okay, flucytosine, amphotericin B, and consolidation, you give fluconazole, all right, for 8 weeks, right, just to kill off more burden of the fungus. And then maintenance is fluconazole for a year. All right, fluconazole for a year. Okay, so there's no prophylaxis for Cryptococcus neoformans like you would expect for, like, let's say PCP, pneumocystis jirovecii, or let's say things such as herpes and HIV. There's no prophylaxis for Cryptococcus. That's a little bit about that. And then, whenever you're treating things in HIV, you can have something called immune reconstitutional syndrome, which is basically that you're actually getting better. Your immune system actually is becoming more robust because you're getting rid of HIV, but that in turn causes you to get a little sick. So sometimes that's why you want to kind of hold off the heart therapy after you kind of treated the Cryptococcus, okay? So you want to kind of treat this first and then give the heart therapy later. Okay, so that's a little bit about this. And then let's go to Molluscum Contagiosum. So Molluscum Contagiosum actually it's very similar presentation, but here you want to think about any person that can be an increased risk for HIV/AIDS, right? That has multiple skin lesions. Multiple is the key here. It's not a few, it's multiple disseminated skin lesions that actually are all over the body. They're pedunculated, right? They're pedunculated. Umbilicated is another word they use. Another word they use is exophytic. Okay, another word they use is like, they also love to use flesh-colored lesions. Exophytic, flesh-colored, umbilicated lesions, dome-shaped lesions. These are all like buzzwords that you need to remember for Molluscum contagiosum. All right, and remember it can be spread, and if it's on the penis, it's actually considered an STD. Okay, Molluscum contagiosum on the genitals is actually considered an STD. So you want to prevent the spread. You want to do some ablation of the lesions and whatnot, but most of them actually go away by itself. But if it's in HIV and AIDS, you want to give heart therapy. Okay, anytime you have HIV or AIDS, the first thing you do is actually give heart therapy. You don't give heart therapy under 200 CD4. If the CD4 count is under 200, you do not start then. The moment they're HIV positive, you start heart therapy immediately. Okay, that's key. And I guess the last one we talked about was sporothrix shunki. This is kind of like a dimorphic fungus. All right, so we're going to be talking about a fungus, and why this is here is because it can actually cause lesions on the skin, right? Lesions on the skin, and these lesions kind of can look like, lesions that maybe are presenting in an HIV patient, but the key here is that history. So you want to make sure that this person is like a farmer. All right, they're a farmer, they work in a soil industry, they had trauma in plants, something with the gardening area, okay? Something that has to do with soil or gardening. They got hurt while doing that. And then indolent, this indolent course, they're getting like nodule, and this nodule is just actually ascending and causing something called lymphangitis. Remember, lymphangitis usually caused by group A strep, right? It causes a bacterial lymphangitis. This is more of fungal lymphangitis, and it's indolent. Group A strep would be more acute. And here, what you do is, since it's indolent nodular lymphangitis, it can actually, the lymph nodes can and the lesion that's a nodule can pop and they can ooze. All right, it can start oozing, but this is not painful. It's painless. Okay, it's painless. It doesn't hurt. It doesn't hurt. It's indolent. It's a nodule in a farmer. So here you want to give basically these patients, you want to give them a long-term treatment of an antifungal, and everything should get back to normal after that. So that's a little bit about HIV, AIDS, and a little bit of a differential diagnosis, and I'll come back with another video soon.